You would think that women's rights groups would be shining a light on the risks and potential consequences of this procedure. Women's rights groups have a conflict of interest as they present this procedure as safe and easy. Even though this procedure is done only on women, this discussion is of equal importance to men for two reasons. The first, it's often the partner that pressures his female friend into this procedure. Studies suggest that 64% of the time, she would not have chosen this option without that pressure. Secondly, men may experience deep regret afterwards.
But I was smoking it excessively, I found. Unconsciously, I was smoking it more and more after that. It was a way of just trying to, I guess, escape and not think about it.
Dr. Deborah Senni is a family physician who specializes in obstetrics and pediatrics. She won the 2006 Mentorship Award for the Rural Ontario Medicine Program and the 2004 Ontario College of Physicians and Surgeons for Excellence in Community Medicine.
Abortion is perceived as a day surgical procedure which is essentially benign. We do a lot of day surgical procedures. The other two common day surgical procedures that we do are knee arthroscopies, and the orthopedic surgeons have a complication rate of 0.15%. The other common day surgical procedure, which is seen as benign, is a hernia repair. That has a post-op complication rate of around 1%, and the majority of those are directly related to the anesthetic.
My friends and I were researching online the matter of abortion risks. We noticed an incredible gap between what is being claimed by those who dismiss or minimize the risks of abortion and those who have great concerns about it.
Possible complications.
Oh,
okay.
Maybe
Infection, half of 1%. Incomplete abortion, less than 1%. Damage to the uterus, 1%. Cervical tear, half of 1%.
So that the post-abortal complications, which are about 11%, looking at the literature in Britain and in Europe, and we're talking the immediate, within the first 3 months post-op complication rates. So that's a drastic difference.
Those who have very deep concerns say there's over 500 studies about these risks. Enough file folders to fill these 5 boxes. The studies have included millions of women across numerous countries. The research, which physicians call literature, reveals the risks of 2 groups of unexpected complications: physical and psychological. Within the physical, this documentary will cover 7 risks. Those who provide the abortion services suggest that these risks are minimal or non-existent. We are going to present the evidence and let you decide.
To summarize the effect in terms of the immediate consequences of an induced abortion, we see in Canada about a 5% rate of return to emerge or to the doctor's office directly attributable to hemorrhaging. Of these, half of these women need to go back to the OR. If you calculate that, you can do the statistics yourself. We have 100,000 induced abortions in Canada a year. 5% of that is 2,000 women.
I mean, this one case in London is terrible. Just a young girl, about 18, with a whole life ahead of her, has an abortion, bleeds to death from a supposedly safe, and that was done in a hospital by a qualified obstetrician. So, I mean, this is a terrible thing, but I think it's pretty rare, thank God.
That death occurred in a major city hospital with all its safety policies and procedures. Hemorrhaging is a risk. It is important that we understand what actually happens in an abortion. During a surgical abortion, the fetus is taken from the uterus after gently, although physically, forcing open the cervix with a surgical instrument. Sometimes, this damages the cervix muscle, just like a sports injury can permanently damage muscles. The consequence, if that happens, is unknown until in the future, when you want to carry a baby for 9 months. Your cervix muscle is too weak and the child is born prematurely. That is a big problem.
An induced abortion could either be a surgically induced abortion or a medically induced abortion. With a medically induced abortion, we give the woman 2 different types of medication, which basically kills the baby and puts the mother into labor. With a surgically induced abortion, what we do is we dilate up the cervix, and then we go in with a suction catheter and suck out the contents of the uterus, which would include, of course, the fetus and the placenta and the amniotic membranes.
The third risk, it doesn't happen all the time, is that the walls of the uterus can be damaged by the instruments used to remove the fetus. If this happens, the consequence is that it is more difficult for the future fertilized egg to attach itself to the uterus.
In terms of delayed consequences, there's also the very, very real problem of follow-up subfertility, infertility, or problems with pregnancies. And as a family doctor, we might see that coming into the office because somebody comes in who wants to become pregnant, and in their distant past history they've had an abortion, and it needs to be considered. The people who see those most often are the infertility clinics.
If an abortion uses the chemical process instead of the surgical instruments, there is a very small but serious risk of reaction to these chemicals. Keep in mind, these chemicals must be strong enough to accomplish their intended purpose. Our body's natural immunity is what helps us fight infection. Sepsis is a serious medical condition in which your whole body, instead of just a finger or a foot, is infected.
And that they postulate, and nobody's actually proven it, is because one of the medications changes our immunity. And that's why a couple of the women who've had post-abortal PID caused by following a medically induced abortion have actually died from overwhelming sepsis because of this change in your humoral immunity.
Another risk is a problem called PID. That's short for pelvic inflammatory disease, which is an infection that has its own complications.
Both of these, interestingly, have an increased incidence of post-abortal PID. Initially, it was thought that only it was because you were actually introducing the suction catheter, and it was that was why the women became infected following their induced abortions, because you carried the bacteria from the lower genital tract into the higher genital tract, and it deposited there and started to grow. But what we found is with the medical induced abortions that the PID rate is almost virtually the same.
Fortunately, pelvic inflammatory disease doesn't have to happen. You can take antibiotics for it.
So the antibiotics work, but the problem is that when they're given to people, a prescription is given to somebody who doesn't have a drug plan. If they're not sick, they won't fill it. And similarly, if a prescription is given to most people and they take the pills and they don't feel well after they've taken the pills and they're not sick, they won't continue to take the pills. And we call that non-compliance. So that non-compliance rate causes that 8% incidence of PID.
Having PID is a risk that can lead to a very serious complication called ectopic pregnancy.
Going onwards from that, once you've had PID, if you can achieve a pregnancy, then one of the problems that women get into is ectopic pregnancies, which means the baby actually starts developing in the tube instead of in the uterus. And this is a medical emergency and needs to be treated on an urgent basis because it can actually cost the mother her life.
And I went to several doctors in an attempt to find out what was wrong. I knew something was seriously wrong. The first doctor diagnosed it as a bladder infection and gave me antibiotics. The second doctor, actually at the hospital after I had passed out in the bank, diagnosed it as muscle spasms and gave me muscle relaxants. And I was directed to go home and, take the muscle relaxants and try to sleep. As I curled in the fetal position that night, I knew that I was dying.
I spent most of the night in Emerge. I was finally admitted to the hospital in the wee hours of the morning. And then a nurse came and said, "You're pregnant, but you can't keep the baby." I was like, "Wait a minute, what do you mean? I can't keep the baby?" She said, "Well, it's an ectopic pregnancy." And she really didn't explain what that was, but she said, "Don't worry, dear. Most women get pregnant within the year." It's like, this this life was just being dismissed, you know.
I didn't know what it was. I thought maybe it was cancer because it felt like it was growing inside me, and I had never heard of anything, I'd never heard of an ectopic pregnancy. In the end, the ectopic pregnancy ruptured, and I was rushed back to the hospital. I was bleeding profusely. I underwent emergency surgery, and my life was saved.
The literature is divided in terms of whether induced abortions lead to ectopics. What we definitely know is that PID leads to ectopics, and we definitely know that there's an increased rate of PID following induced abortions.
So we know that an abortion increases your risk of having a PID, and a PID increases your risk of having an ectopic pregnancy. What to expect?
Myths, what should you believe? I won't be able to get pregnant after an abortion. An abortion performed by an experienced physician under sterile conditions does not hamper a woman's future fertility.
Those who earn money from providing abortions say that having an abortion does not increase the risk of a fertility problem. They say that's a myth created by people trying to scare you. Keep in mind, the researchers who have concerns for your health have nothing to gain from your decision. But those who want you to say yes to an abortion have a business to run. They have staff to pay, heat and light bills, taxes, rent, and they have to make sure that there's enough profit left over. Jean Eklund, former member of the Faculty of Nursing at the University of Windsor and former director of nursing at Windsor's Metropolitan Hospital, is a published author in professional journals. She has invested her career in research and palliative care, the medical discipline which focuses on patient needs at the end of life. Jean has won the award for excellence by the Ontario Palliative Care Association.
There's often a problem with fertility in the future, and again, three of the patients I had stressed this, that they were unable to get pregnant again. So what one of their gynecologists had told them, she had what's referred in the literature to Asherman's syndrome, which is actually scarring of the wall, the inside wall of the uterus.
But we wanted to have more children too, and nothing was happening, and I went to the specialist, they took some tests, and they discovered that my uterus and my cervix were so damaged and so scarred up from those abortions that they could not believe that I had him.
I found out in my 20s when I was trying to get pregnant that I couldn't get pregnant, and I was blaming my fiance, he was blaming me, and so we both went to a doctor to get checked out, and it came back that I was the one that had scar tissue on the inside of my uterus, and I had about a 17% chance of getting pregnant. I didn't even tell the doctor that I had 2 abortions, but he knew as soon as he did an internal. They know that the cervix has been touched in such a way that I wasn't. He knew I had been pregnant, and he said, well, what happened? Well, I didn't have a miscarriage, I had 2 abortions.
Dr. Barry DeVever is a surgeon and professor emeritus at the University of Western Ontario. He's formerly director of pediatric oncology for the Children's Hospital of Western Ontario and is recognized around the world for his pioneering work with palliative care in children.
Well, first of all, women who've had abortions do have an higher instance of infertility. I quoted 6%. There's also a figure of 72% have chlamydia or STDs, but there's definitely an increase in infertility. It's not huge, but it's there. And as far as carrying it to term, well, we've already said there's a higher instance of premature delivery. So you've got 2 problems relating to that.
You recall the analogy of the sports injury to the muscle. Sometimes it never fully recovers.
Is, I think, the most severe complication of abortions is premature babies followed by cerebral palsy. And there's no question that women who have abortions are far more likely to have a premature baby because the mouth of the womb's been tampered with and it's more sensitive. So that makes sense scientifically.
But what that works out to is the equivalent risk as if you were smoking a pack of cigarettes a day during your pregnancy. So it's a very real risk, a risk that we recognized when people were smoking, but a risk that we do not attribute to induced abortions.
And then, of course, if they have a small baby under 33 weeks, it's a very high incidence of cerebral palsy and brain defects.
The risk increases and escalates if you've had more than one abortion. So 2 or more abortions, that risk of having a premature delivery, very low birth weight baby, goes up by 2.5 times.
And some women who have one abortion will have multiple abortions because they're not dealing with the reality of what an abortion really is and what it does.
The parents would be often not even aware of the fact that there would be a link between their premature infant and something that the mother chose to do 10, 12 years before that.
One of the most recent studies came from Germany in 2008. There, 1,065,202 were researched. It found that 2 or more abortions virtually guaranteed a premature baby. At a 90% risk factor, it stops being a risk and becomes a virtual guarantee. Those who want you to believe that there are minimal or no risks with an abortion use the word myth and denounce concerns as being based on old research. Is 2008 old? Is the study of 1 million births a myth? As you try to decide who to believe, remember which group gets paid as you choose an abortion.
With your extremely low birth weight babies, the incidence of mortality, dying, is 25%. Of the 75% of the children who are born low birth weight, who survive, half of those will end up with a major disability. And in those families, we looked at those families. There was a study which was done in the pediatric literature. Over 85% of those families break up within 5 years of those children being born. So the cost is great.
The newer studies consistently showed no association between induced and spontaneous abortions and breast cancer risk.
You would understand that a woman who has just been diagnosed with breast cancer would not appreciate being asked if she has had an abortion. So establishing proof that there is or is not a link is not easy.
There were 33 studies which were done looking at the linkage between induced abortions and breast cancers prior to 1995. And then BRIND, B-R-I-N-D, took these studies, did a meta-analysis of them, and found that in 27 out of these 33 studies, there was a correlation between breast cancer and induced abortion. And the correlation was highest for the women who'd had their induced abortion before they had carried a baby to term.
All researchers appear to agree on the statement that Time magazine made in their October feature story on breast cancer. Delivering a baby earlier in life lowers your risk factor of breast cancer. So your risk is now lower. Time magazine also adds that pregnancy and lactation may also change breast tissue by building antibodies that help to prevent cells from becoming cancerous. But if you have an abortion, your risk goes back up. So, if the risk is now higher, why are we not allowed to say that having an abortion raises the risk of getting breast cancer?
Women need to know that when you are pregnant, in a healthy pregnancy, 2,000 times the estrogen is naturally pumped into the breast.
And within minutes, 5 minutes, the abortion is done and the body's crashing. It's trying to figure out what went on. The breast has developed cells that now don't know what to do, don't know where to go, which down the road years later can be cancerous.
My sister died at the age of 50 from cancer. My mother had 2 bouts with breast cancer, one in her 40s, one in her 50s, had a double mastectomy, and died of cancer on my birthday this past year. And so I wonder what the future, holds for me.
And I'm very outraged and sad and disappointed because I know cancer societies are raising millions and millions and millions of dollars every year, and yet they are denying the link between abortion and breast cancer, and yet they will say that delaying a first full-term pregnancy increases your risk of breast cancer.
But we do tell women, don't use hormone replacement therapy following menopause because it's going to increase your breast cancer risk. But the risk increase in terms of using HRT and having an induced abortion in terms of causing breast cancer is exactly the same. So we're actually like the ostrich. We keep our head in the sand and we ignore the post-op complications of induced abortions to the detriment of the health and the well-being of women.